Hi,
Hi, how are you doing?
better for seeing you.
Oh, you as well. This is going to be a lot of fun.
I'm looking forward to this. I want you to, I'm not going to introduce you. I'd like you to introduce yourself and
Okay.
tell us why you have the passion for what you do and how it helps you, your loved ones, the world. So that's where
Okay.
we can begin, and then we'll just go in any direction that you want because I really want this to be a showcase on you.
Okay. Wonderful. Thank you. And so we'll hang here and then we'll go to Instagram after.
Yes, yes. We're already
Okay.
recording. This is the IG Live. We'll edit it. And yes, we'll then switch over to the Zoom for a podcast.
Oh, okay. All right. So do you want
Yes,
me to just
we try to do two things at one time or two things sequentially.
that's very smart. Very smart. Um, yeah, do you want me to go ahead and dive in?
Yes.
Okay. Well,
So
yeah.
well, let me sorry. Uh, we have the great privilege of having Renee Belz with us today. I've asked her to introduce herself and tell us why she is so successful and passionate about being healthier.
Thank you for that introduction. Yeah, I'm so happy to be here. I've been following you for as long as I can remember. You were on my podcast a couple years ago, but I actually read your book back when I was getting my
Good,
master's in nutrition. That
good.
was required reading, and that was almost 15 years ago. So, it's come full circle. So yeah, I'm happy to be here. My health journey, I think it's similar to other people, right? That's why we become practitioners because we realize there are more answers out there that we aren't being told maybe by our traditional doctors or whoever's in our circle. So, it really started as a kid because my parents, I'm so fortunate, they have been in the holistic biological dentistry field since the mid 80s.
Ah, that's where I know the family name. Right.
Oh, okay. Yep. So I grew up with kind of a holistic minded, health conscious family, which was great, but I still went off to college and started eating all the things a typical college kid eats and sleeping 4 hours a night, working full time, going to school full time, and I graduated and I just totally burned out. And that's where my health journey began. I got a terrible case of mono, also Epstein-Barr virus, and I was just completely bedridden. And my traditional doctor said, you just need to sleep more. That was the only solution. They said, your labs are normal, you look great, you just need to sleep more. And I'm like, I'm telling you, I'm exhausted. I'm sleeping 12 hours a night, just feel terrible. And so that led me down to discovering biohacking. I did go back to my parents and I said, what am I missing here? And I started working with a wide range of practitioners. I ended up going back getting my master's in nutrition, but it wasn't one thing causing this extreme chronic fatigue. It was the mono, it was poor circadian rhythm, poor sleep, poor diet, hypoglycemia, HPA axis dysfunction. It was like mercury toxicity. Everyone wants to say, what was the one thing? It wasn't one thing. I had to put all the puzzle pieces together. And that's the beauty of biohacking and why I love sharing it with the world is we are all so unique. So what's going to work for you is not necessarily going to work for me and the next person. And so biohacking
But
enables
let
that.
me, if I can interrupt, I want to jump in on
Yeah.
one specific point. We can, and we have defined the four self-assessments and the eight predictive biomarkers that give you a true measure of your health span.
Mm,
What you say is absolutely correct. You cannot expect a doctor who is not trained in lifestyle, nutrition, attitude, environment, etc., to have intelligent suggestions about what to do other than get on with life. When someone's told you, you're only sleeping 12 hours a day, you need to sleep more, you need to nap more. That's not bad advice, but it's 30, 40, 50 years out of date.
mm.
And you
Wow.
correctly took one issue at a time. And I take it you're thriving now. And I want everyone to be thriving in the 21st century. That's our book, Thriving in the 21st
Yes.
Century. That was a commercial. And I want everyone to know that we should be biohacking on our own behalf because we have more experience with ourselves than anyone else. And when I need help, which I do from time to time, I want someone who knows more than me. I don't want to be the smartest guy in the room. In fact, I want to be the dumbest guy in the room, but I want smarter people. And I've had many experiences where the conventional medical community unfortunately misunderstood what was going on, did not do the right metabolic or contemporary functional testing, and would have harmed the people that I really care deeply about. I
Hmm.
don't practice. I've never sent a bill as a doctor, but I've been involved with biomedical research at NIH and beyond. And I'm convinced that consumers will lead the future of healthcare. Physicians will respond to what their clients and patients request.
Hmm.
So I want you to ask questions. And when the doctor looks puzzled, just stop because you can't go into an area where someone is woefully ignorant, my words, and have a productive conversation. But you can find a health coach. You can find a functional, integrative, holistic physician. In the late 1970s, with Norm Shealy and a number of other giants of that time, we founded the American Holistic Medical Association. And I will get back to you, but I believe that I was the only speaker featured on the first and the last 35 years later, program from AHMA, which has now
Wow.
morphed into other integrative organizations, and it's taking off. I predict, just like acupuncture has become a profession, that health coaching is and will grow substantially because even if the doctor is receptive to lifestyle and attitude, etc., someone needs to unpack the issues. Someone needs to
Hmm.
have time to inform, inspire, motivate, and hopefully help people make changes. I want you to
Absolutely.
have a makeover in your kitchen, your bedroom, your personal care, and your environment. And I am a living example of that. I've been at it now 15, 20, 30, 40, 50 years. And along the way, I have found more ignorance than wisdom.
Hmm.
I want to get back to
Wow.
what you are saying, but I also want to emphasize that personalized prevention is available today through health coaches, through knowledgeable health professionals, and through biohackers.
Yeah, it's pretty wild. I'm sure you've really seen this evolution of healthcare. It's pretty wild to see. And a question I get a lot is, what's going to happen with AI? Is AI going to take over healthcare? And I think it could help because maybe it's going to put those puzzle pieces together a little faster than, maybe I experienced 20 years ago. But you're right, we always are going to need health coaches because people are always going to need strategies of how do I implement this into my routine. You can have all the knowledge in the world, but if you don't know how to do it every day, then you're never going to see the results. So you're right, health coaching is going to be huge.
Facts are important, facts are a start. It's what you understand and feel inspired, motivated to make little changes that have profound impacts on vitality, restorative sleep, blood sugar, blood lipids, all, all of
Yeah.
this comes into healthy balance. We basically predict that the Goldilocks scenario will prevail. Just right for the individual is just right. Too little is too little, too much is too much. What a
Yeah.
surprise. I learned that as a child, and it still
Yeah.
provides a moment to be amused to be lighthearted about how easy it is to make the changes that will add life to years and years to life.
Hmm. Yeah. I love using the Goldilocks analogy too for hormesis because biohackers are obsessed with hormetic stressors. We got, high intensity interval training, cold plunges, saunas, fasting, right? The biohackers love that. But you can have too much of a good thing, right? So hormesis,
That's
we want to
absolutely
balance
true.
that.
In fact, there is a colleague of ours who has been studying ultra athletes, people that do Ironman Hawaii and things like that.
Hmm.
Often, often they collapse at the end of the race because they've run out of ascorbate vitamin C and they have scurvy
Oh,
and they
wow.
lack magnesium and they're acidic. And without magnesium, your ATP energy doesn't form. Your
Right.
battery stops working. There are many enzymes that require magnesium. So we figured out how to get the magnesium in, how to get the ascorbate in. And now people who used to suffer but enjoy the race and
Hmm.
prevail. They did prevail, but at a cost to themselves. Very often it takes a week or more to recover from these kinds of ultra elite activities. And yes,
Yeah.
I'm so glad you said that more is not better. Cold
Yeah, like
plunges,
the woman that did a one marathon a day for I think a year. Did
that
you
was
hear about that?
amazing. That I have heard about those anecdotes. There are some physicians who enjoyed marathon running and then had imbalances in their electrolytes, imbalances in their blood sugar, imbalances in their stress hormones.
I bet.
I want you to have more of dopamine, more of oxytocin, more of the feel good hormones, and of course, less of the cortisol and the adrenalines.
Mm.
But very often, what we get from a quote peak experience, like a cold plunge, and by the way, I like to turn the shower to cold just at the end of my shower,
That's great.
and it's bracing. I don't leave it on long enough for my teeth to chatter. So I do feel that modest stresses help our body to function well. And be careful
Yeah.
about ultra stresses and balance out the nutrition, the environment. For example, many people exercise, but they don't stretch. If you
Mm.
don't stretch, the nutrients can't be brought to the cells and the waste cannot be taken away. Well, that's kind of important. How come nobody told me to stretch? How come nobody told me to get up 5 minutes an hour from sitting? Now
Yeah.
we're obviously sitting here, but
I'll
as soon
stretch
as we're done
after.
recording, I'm going to get up and stretch and look around and move
Yeah.
around. These are easy to fit into your day. And I think if you make it accessible, if you make it one little step at a time, and then help remind people that they're feeling better.
Mm.
When I ran the Princeton Bio Center, a couple came in, and after 6 months of the husband came back and he said, well, I'm not sure anything changed. And his wife said, but dear, you lost 65 pounds and you had to buy new clothes. He said, oh, that's true.
Oh my gosh. That's what wives are for, to remind the men. No, I'm just kidding. That's
This was said
wild.
to me,
60
but
pounds.
my spiritual advisors have all said that women have an advantage and men need to work harder.
Oh. Yeah, that's quite a drastic change. Yeah, I mean, I find with clients, really journaling can be so helpful just to be collecting that subjective data because I think I see that too, oh, it's been 3 months, I don't feel any different. And I'm like, but according to your journal, you have no gas and bloating, no more constipation, you lost 15 pounds, and they're like, you're right. Yeah. I think so. The data collection is great. So whether it's subjective, like a journal, or objective, right? We have all the wearables that we have access to and lab testing, of course, can be
All
very
correct,
eye-opening.
all correct. Just the act of recording, either digitally, with a pencil, with a color, however, is helpful.
Hmm.
In fact, when I go to sleep at night, I very often ask my spirit guides, whatever that means, to help me solve a problem.
Mm.
And in the morning, I very often have a solution. Now, I was getting restorative sleep, I'm glad to say,
Yeah.
but my spirit guides were working on my behalf. So, journaling, I highly recommend whatever way you enjoy. And by the way, enjoying better health makes it much more helpful. So,
Hmm.
you should do what causes you to smile and not frown. It takes 14 muscles to smile, it takes 40 muscles to frown. If you want to raise your cortisol, frown. If you want to raise your oxytocin and dopamine, smile. My colleague, Patch Adams from the movie Patch,
Oh,
he
yeah.
recommended chakra therapy, which is laugh for 5 minutes twice a
Oh,
day. Just laugh. If you want to watch a comedy, fine, but just laughing turns out to be healthful. So there are things
yeah.
that low cost, high gain, but we need to be engaged. Someone needs to clear the marketing fog because there is a lot of marketing and it's highly successful. I want you to take this medicine, which will get your hemoglobin A1C down to 7. I want your hemoglobin A1C to be 5, like mine has been for 20 years or more, once I lost the weight. And these are predictive biomarkers. These are self-assessments. These are things that help inform you about how your body is functioning with regard to hydration or digestive transit time, or how much vitamin
Mhm.
C do you need to cleanse your body, how much magnesium based on your urine pH in the morning. Simple, dollar a day or so,
Yeah.
and overlooked except by a few academics. There are colleagues of mine that are brilliant and on the prevention, proactive, personalized prevention bandwagon,
Mm.
but they're not really promoted much by the synthetic industry. There's a whole industry of
Yeah.
pharmaceuticals. I think physiology should be applied, nature should be applied before pharmacology. I want you to be hydrated. I want you to stretch. I want you to enjoy living. And then I want you to know that even in our toxic times, it's very possible to thrive, as you seem to be
Absolutely.
doing. And I want to come back to something you said because I think it's so important. Doctors look at routine blood tests and they look at the person and they say, you just need to sleep more.
Yeah.
No, you did the wrong tests. You didn't find the nature of the cause. Root cause medicine is a phrase that I enjoy using.
Yeah, same.
We have unprecedented access to wisdom, to knowledge, to information, but we have to go find it ourselves or with the help of a biohacker or a health coach.
Absolutely.
Today, doctors have less than 15 minutes to say hello, goodbye, write a prescription, and to make notes.
Mm.
That is not a relationship. I want a doctor who will take enough time to talk to me. What are my concerns? What are his thoughts about the causes of my concerns, suffering, or whatever? So, as you can tell, I feel
Yeah.
passionately about this because we can save 1 million lives a year with what we already know, let alone what might come down the pike. We could save $1 trillion of the 4+ trillion we spend on
Oof.
sick care in this country annually. Over $1 trillion is to cause you to suffer more, live shorter, and have very expensive care. That's
Yeah.
not health care. That's some kind of a perversion of the system. But what's a person
Fair.
to do? How do we find out about ourselves and take charge of our personal health? Because if you do and I do, the people around us will.
Hmm.
And if we slack, they will too. It's called the spreading phenomenon. It's been very well studied and documented. I am first and foremost an evidence-based person, but then I want to know about the remarkable person in front of me at the moment. And I'm not going to put a label. I'm not going to make a diagnosis. I'm not going to talk to you about you being a fatty liver person. I'm going to want to get the fat out of your organs
Yeah.
naturally and effectively so that you can avoid cirrhosis, so that you can avoid viral illnesses. We know enough to intervene in most chronic ill health. And it turns out that nature, nurture, and wholeness provide enormous opportunities if you're willing to be retrained. I
Yeah.
fortunately was curious enough and was willing to show up so that I got trained in TCM acupuncture, I got trained in Ayurveda and yoga, I got trained in mindfulness and social Buddhism.
Hmm.
I was greatly fortunate to have people who put up with me. They didn't have to. They were all very accomplished in their own right,
Hmm.
and their community was thriving. I want us all to live in a personal blue zone. I hope you understand what a blue zone is. It's where you feel and function best. And I think we can create personal blue zones for ourselves. What do you think?
Absolutely. I love the blue zones in general, but yeah, I think there's so much we can get for free from Mother Earth to provide this, blue zone around us. Just being in nature, that's a completely free biohack. Getting morning sunshine, daily sunshine, obviously for vitamin D and circadian rhythm and oxytocin and neurotransmitters and better
We
sleep.
we we live in a mature woods on a hillside.
Oh, wow.
We have 7 mushroom guilds that are right now producing mushrooms. We have no front yard. We have a permaculture biodynamic food forest in place of our front yard. And we
Wow.
eat what we can of herbs and brassica and fruits and whatever's in season and vine ripened. Because one of the
Amazing.
secrets to good health is that vine ripened is better than store bought. So if
Absolutely.
you have even a little bit of herbs or vegetables from the garden, first of all, you could feel really good about going out to the garden and harvesting something.
Yeah.
And then you share that with the people you care about, and your nutritional quality goes up. Now,
Absolutely.
I think everyone can grow a little bit of something
Hmm.
parsley, sage, rosemary, and thyme, or
Yeah.
similar. You can grow your own avocados.
Hmm.
Most food is harvested 2,000 miles from you. Most strawberries travel 2,000 miles. Most orange juice travels 2,000 miles. Now,
It's crazy.
we have lots of berries in our garden, and in succession, we enjoy them, and so do the squirrels. But we eat seasonally. We eat what nature traditionally provides.
Yeah. Most
Many
people don't
things
do
that were
that.
true in our grandparents' time have been completely restructured by the synthetic industry, adding preservatives, adding the wrong salt, the wrong fat, the wrong protein, taking away the fiber. If you wanted to create a perfect storm of chronic disease for most people, over 80, maybe as much as 93% of people today are chronically unwell and suffering.
Hmm.
There are fortunately a few percent, like yourself, and I would like to be included, that feel and function at half their chronology. When I mark my biomarkers every 6 months, I look at them and I take heart in the fact that my heart is half, functions at half my chronological age.
That's amazing.
I
Yeah.
think everyone deserves that.
Yeah.
Yes, I'm in a minority, but I've always been in one minority or other.
Yeah, I mean you're taking responsibility for your health and it does take that to be healthy because it is easy to fall into the trap of just buying the junk food at the local store and not getting outside in nature and not exercising. Our planet has made that the go-to for people. So you do need to take the next step and take responsibility for your health and start doing the things you need to do. And it's
and
worth it
and,
because
and
when you feel better,
enjoying doing them. As you point
yes.
out, you should monitor and mark with a journal or similar so that you can look back and see how things are progressing. And I
Hmm.
want you to be more and more thriving and less suffering.
Yeah, absolutely. I think it's possible. It's possible in today's world.
Even
Yeah.
in today's world. Now, we are in an intoxicated world, no question. But 80% of the toxins you can avoid, and the other 20% you can get rid of by having bioavailable perk type supplements to
Mm.
encourage your liver, spleen, kidneys, lungs, heart, infrastructure, digestion to all be at their best.
Yeah. We have the information, we have the access. We just need to keep sharing the word and educating. That's the key.
So, thank you so much for today. Thank you for being you. Thank you for spreading the word as you do. And
Thank
I
you.
am thrilled and delighted to have you as our guest on today's IG Live. So thank you so much.
Thanks for having me.